Good afternoon, everyone, or good morning to our friends on the West Coast and Mountain States. And welcome everybody to today's roundtable event on Headstart and Universal PreK. We really appreciate your choosing to spend your valuable time with us, especially today. I'm Yasmina Vinci, Executive Director of NHSA, and I invite you to introduce yourself in the chat. Let us know where you're logging in from and what brings you here today. We're grateful to present this webinar in partnership with Dr. Chantel Meek, who is the founding director of the Children's Equity Project. Dr. Meek is a longtime partner and friend of NHSA, and in her role at the helm of the Children's Equity Project, she has been the hold on one second. Can you all hear me?
Yes.
Good. Yes. Okay. I was feeling like I was talking into the vacuum. Dr. Meek recently released a report with the Century Foundation, arguing for making Headstart the anchor of a new universal system. And this report was very much the inspiration for today's conversation. Similarly, we're honored to welcome Deputy Assistant Secretary for Early Childhood Development, Katie Hamm, from the Department of Health and Human Services, Office of Early Childhood Development. Katie has a track record of advancing childcare, preschool, Headstart, and home visiting investments. So we're looking forward to hearing her reflections and insights today as a representative of the Biden administration and a passionate and dedicated public servant. We also invited several members of the House to be with us today, including Headstart alumna representative Teresa Ledger Fernandez from New Mexico. But as you know, it turned out to be quite a busy day on the Hill today. And we are grateful to them all for the work they're doing right now to shape the future of universal preschool and childcare. And what a day we ended up having for this conversation. Speaking of Headstart alumni, I'm proud to share that we have reached a new milestone this year, and that's 37 million children have been served by Headstart. So if there are any Headstart alumni on this call, please take a moment to say hello in the chat. Innovators, communicators, advocates, and thinkers, healthcare heroes, and teachers themselves, our alumni represent the vast and diverse fabric of America. And when we speak with them, many recall the warmth they felt from their Headstart teachers, the kind words that gave them comfort, or nutritious meals that felt like home. Some recount how the health screenings helped them with their dental or vision challenges, catching those things early. For many, their Headstart experience imprinted a love of learning, a lifelong love of learning. Their stories, testimony, and experiences are 37 million living proof points of Headstart's impact, now backed up by decades of rigorous research on Headstart and more recently on early Headstart. And that's why for those of us who have been in this field for some time, the willingness of Congress to commit to preschool for all is a thrilling prospect. Universalizing access to preschool recognizes that early learning and care are so critical to America's success and future that everyone needs access. However, if the last 60 years have taught us anything, it's this. Universal access alone cannot ensure equitable outcomes for all of our nation's children and families. And the title of this webinar, What We Know and What We Need, is really what today's discussion is all about. So we know this proposal to scale early learning opportunities for all children has the potential to transform society. We know that Headstart has ushered in many of the same successes that the AFP hopes to perpetuate. Things such as higher labor force participation among parents, increases to family earnings, and economic growth. And we know that the Headstart model, the most studied and proven with evidence of both short and long-term positive impacts, helps children succeed in school and in life. We know the model supports families to weather crises and reach for opportunity. Above all, we know Head Start strengthens families. What could be more important? So today's conversation will focus on what we need to build a high-quality inclusive preschool system. It's essential to meet the complex needs of our country's most vulnerable children and families. The persistent achievement and opportunity gaps that face families with low incomes, who are also disproportionately Black, Hispanic, and Native American, are unacceptable. We need to build on the Head Start model. 37 million proof points light the way forward. NHSA is very encouraged by what Congress is discussing and debating in committee right now, which includes $15 billion to increase compensation for the Head Start workforce over 6 years. This is our field's most pressing priority across both preschool and infant and toddler staff. Protection for Head Start, specifically calling for states to support full enrollment in Head Start. Also, expansion of state pre-K in the model of Head Start, including incentivizing comprehensive services for families with low incomes and paying programs adequately to deliver them. A recognition that high-quality childcare should meet or exceed Head Start program performance standards. So turning back to our event today, this will be the first of many conversations and dialogues we will need as a community to expand access and opportunity to all of our youngest learners and their families. We look forward to hearing from our distinguished guests today and to shaping what Congress enacts in the coming weeks and months towards equity and quality for all children and families prenatally through their first 3 years of life, in preschool, and beyond. And now I would like to turn the mic over to Dr. Meek for her introductory remarks, followed by her facilitation of our distinguished panel of researchers. Dr. Meek.
Thank you, Yasmina. It's such a pleasure to be here with you and with everyone on the line today. I'm excited to be here to talk about an issue that everyone in this room feels deeply passionate about, I know. As some of you know, I come to this work with a set of unique experiences. My grandparents immigrated to the US from Mexico, and I grew up in a small, pretty homogeneous and bilingual border town in Southern Arizona, where most everyone shared a similar background, whether first, second, or third generation. We're all Mexican American and immigrants or descendants of immigrants. I attended Title I schools throughout my educational trajectory and had the luxury of having many excellent teachers who shared my background and my home language. I went to a public state university, the same one that I happen to work for today, where I conducted research and I started my work with Head Start on learning language for DLs, dual language learners in Head Start programs. I then joined the Obama administration as a senior policy advisor for early education, spending most of my time at HHS and then some time at the White House Domestic Policy Council. And now I founded and I run the Children's Equity Project, a research policy practice think tank exclusively focused on advancing equity in early childhood and K-12 education systems. Today, I'm excited to share with you a little bit more about the new report that Yasmina just mentioned, articulating a vision for universal pre-K that is grounded in quality and equity. And I'd be remiss if I didn't say it, but while the focus of today is preschool, the importance of investing in quality holistic learning in the years before and after preschool cannot be overstated. Indeed, preschool only works when it's preceded by quality, rich experiences from birth, whether that's at home with extended family and friends or in childcare, and followed by well-resourced quality schools that center child wellness, community, families, and developmentally appropriate learning. So to jump in, for this report, we really weighed 4 things. The first one, and the central one, was what we know about child development and optimal learning conditions for kids. Science told us a long time ago what the optimal conditions for learning are. Kids learn best when they're safe, when they're healthy, when they're loved. And that means they have access to healthcare, mental health care, dental health care, safe and stable housing, and live in economically secure households. And they have access to rich, engaging, inquiry-based, hands-on learning experiences. When we try to narrow the focus to academics exclusively, we don't get the outcomes we hope for and that we know are possible when we invest early. So we know what's best for kids. 2, the current state of the system. It's not a secret that the early care and education landscape is extraordinarily uneven in quality, in standards, and accountability, and in funding. If the goal is to build a universal system, lifting up quality and evening out that existing unevenness must be part of the work, or else we risk building up from an already uneven system. When we build a new building in a new house, we level the foundation. We don't build on uneven territory because that makes everything unstable moving forward. And we know that low-income children and many children of color are the ones who bear the brunt of this unevenness. Third, the devastating curveball that COVID has thrown our way and its implications on young children and on learning systems. Much has been said and written about the pandemic's effects on all of us, on kids, on families, on providers, on business leaders, on the childcare system, on schools. After living with 18 months of this now, we know COVID-19 has wreaked havoc on the health and well-being and on the pocketbooks of Americans in every corner of the country. Millions of children have faced sickness or loss in their families, disruptions in routine, and economic insecurity and instability, and everything that comes with that. Headstart was already serving just a fraction of eligible kids before the pandemic, and now the number of kids and families who would benefit from such a holistic experience and model has expanded drastically. So as we go into the hard work of designing a UPK system, it's not the same conversation we were having in 2015 or at any other point in time. We need to design a system that meets the moment, and the status quo won't do that. And fourth, no surprise coming from the Children's Equity Project when we focus on equity, but really the inequities in the current system. We know that if we look across kind of different state standards and different parts of the early care and education system, there are inequities in almost every realm, from workforce compensation and conditions, to policies that affect how kids learn, including suspension, expulsion, and bilingual learning and inclusion of children with disabilities. We also know, on the other hand, that Head Start standards embed equity more concretely than any other dimension of the system, including pre-K and childcare. They uniformly ban expulsions, which disproportionately harm Black children. They promote bilingual learning for dual language learners, which science shows us produces stronger academic, social, and even economic outcomes down the road. And they require full inclusion of children with disabilities, a civil right that is too often overlooked. Don't get me wrong, the standards aren't perfect by any measure, but they embed equity more concretely and robustly than other parts of the system. So when we step back looking at those four pieces, it led us to one place, and that was really the Head Start model. It's not exactly a novel concept. It's been around for a while, as Yasmina mentioned, with millions of proof points, but it really pushes our conversation to a place that is centered and focused on kids. One of my greatest mentors, who many of you may know, Linda Smith, used to ask us to pick a child in our lives and focus on that specific child when we're writing policy, because in the end, that's what we're fighting for. So when we asked ourselves what the ideal model is for that particular child or for kids based on what we have today, the answer is one that we've had for a really long time, or at least for several decades, and that's Head Start. So our report really proposes a series of steps to build supply to get to universal, anchored by Head Start quality, the Head Start model, and Head Start quality standards. And specifically, it proposes expanding capacity in existing Head Start programs who are in good standing, expanding Head Start to additional communities that don't have Head Start right now through new Head Start grants, especially in places with low pre-K supply and access. Expanding the early Head Start childcare partnership model to preschool age children through new Head Start childcare partnership models that would bring together the best elements of childcare that address the needs of working families and Head Start that address the holistic needs of the child family community. And then 4, creating a new pre-K Head Start partnership model that brings together this universal pre-K or Head Start funding with state or local pre-K. You know, from the state level, there's plenty of cities, there's counties, there's districts who already fund pre-K, and really bringing that funding together to expand access anchored by Head Start's quality standards. Under this step, communities, districts, states who already operate pre-K programs could apply for funds, blend these new funds via Head Start with their existing investments, and apply the Head Start quality framework and standards across the entirety of the system. This helps level the quality baseline across pre-K and Head Start with a common quality framework, promotes socioeconomic integration, which we know is important and a challenge that we have to focus on. And 3, applies the equity protections in the Head Start model to all kids. It'll no longer matter whether you live in one of the 20-something states that have limited expulsion for preschoolers because Head Start prohibits it altogether. It'll vastly increase the number of children with disabilities in inclusive preschool. We know there are several places across the country where that have segregated, self-contained preschool programs for kids with disabilities that is not in line with the best science. It'll greatly expand access to bilingual learning for our nation's DLLs. And we know all those pieces matter a lot, especially to the children of color and children from historically marginalized communities that constantly have to bear the limitations and failures of our systems. In the report, we also discuss investing in quality, including workforce compensation and sharpening the focus on equity, aligning research and technical assistance efforts so that it's not tethered to a specific program, but just about kids, and investing in state and local coordination to ensure consistently high quality, integrated, and inclusive experiences, regardless of what preschool door a kid walks into. We join the entirety of the field in being thrilled and really excited for the possibility of what Congress can get done. And we also know that there is a lot of work ahead, a lot of hard work ahead to be figured out on the back end with implementation. So we're looking forward to partnering with the administration and the rest of the field to ensure that we do meet this moment. So with that overview, I'm going to introduce our esteemed panel that will share a little bit more about their perspective and their research on the topic today. So first up, we have Dr. Ioma Iruka, who is a research professor at the Department of Public Policy and a fellow at the Frank Porter Graham Child Development Institute, and the founding director of the Equity Research Action Coalition at FPG and the University of North Carolina at Chapel Hill. She is a dear colleague and friend, and most importantly, she is one of the nation's leading voices on equity for our youngest learners. She serves on numerous national and local boards and committees, including the National Academies of Sciences, Engineering and Medicine, the National Advisory Committee for the US Census Bureau, and the American Psychological Association's Board of Education Affairs. We also have with us Dr. Walter Gilliam, who is the Elizabeth Mears and House Jameson Professor of Child Psychiatry and Psychology at the Yale Child Studies Center and Director of Yale's Edward Ziegler Center in Child Development and Social Policy. He's a past president of Child Care Aware of America, a member of the boards of directors of 0 to 3, the Ring Harris Foundation, First Children's Finance, All Our Kin, and a research fellow at the National Institute for Early Education Research. Along with his late mentor, Professor Ed Ziegler, affectionately known to many as the father of Head Start, Walter has conducted extensive research on Head Start, universal preschool, pre-kindergarten, and how they might be coordinated better to meet the needs of children, families, and communities. He is also a dear friend and a colleague and a leading voice for children and equity in this nation. So Dr. Iruka, why don't I start with you? Tell us a little bit about your perspective on the question of a day. What do we know and what do we need from a universal preschool system? And how does Head Start fit into that? And second, if you could address, how can we hold equity and universality together?
Well, thank you so much for allowing me to be in this space. And it's such an honor to be with you, Chantal, and of course, Yasmina and the whole National Head Start Association. I'm so thrilled that we are having this conversation, and which I imagine will be the first of many. And I come to this first, as sort of a mother of 2 young children. I come to this also as a person who grew up in the projects in Boston, one of 7 girls. And so I come to this with that lived experience, which makes up part of my own research world. And I come to this really with Head Start as part of my professional identity, from being funded through a Head Start University Research Partnership in graduate school, to being a Head Start graduate student research scholar, to my continual work in Educare Network and engagement with many local Head Start grantees and programs. And so my understanding about the importance of equity policies and program is really through my connection to Head Start programs, but really to Head Start families, children and communities. It really provided that the lens that I bring to my scholarship, to the research, and to the way that I see the world in many ways. And so before I can get to your question about equity and universality, I want us to sort of lean into this moment, right? That there's always been an opportunity, and this is one of those for America to, I would say, and push to deliver for Black people in particular, but obviously other people of color and those who've been historically marginalized, especially for Black people after the continued extraction of wealth and resources through both free enslaved labor, but also through our continued low wages and racial disparities in the wages. And so part of ensuring opportunity was supposed to be with the universal model under Nixon. And now we're fighting it 50 years later. But to me, I see this as an opportunity that has been provided now to ensure that we have a comprehensive federal program that not only focuses on children, as you have articulated, Dr. Meek, but also families and communities. We know that children's development is also family and community development. And for me, part of it is obviously a personal one and a personal journey that I believe we have to start with Black children, delivering on that promise. Focusing on Black children and families and communities has resulted in transformative change in so many sectors. And we know that part of Headstart's origination was really to make sure that in particular, Black children got what they deserved and what they need. And so now to your question about, is there a way to maintain equity and universality? And to me, yes, and Headstart can provide the equity, which means it has the process and the standards already in place, as you have just beautifully articulated, to ensure access to many marginalized communities that have been left behind historically, to also provide a meaningful experiences because of their tailored programming, and also to outcomes, and outcomes that's beyond just reading, math, and science, but outcomes is about developing your full self, your cultural identity, to developing your family connections, those relationships that last for a lifetime. So it can provide enriched and meaningful experiences. It can meet the diversity of needs, as you said, from bilingual education to supporting children with disabilities, right? The one reason that I think, and I think research, supports me, is that Headstart is an important framework, is not just because of children, right? Our job is not to fix children, but because of the impact on families and the communities. Children grow up in families, and for their families, they need to also ensure that we are improving their health, education, and economic viability. That is the importance of Headstart as sort of the full framing of a model. That to me is the potential and the possibility of Headstart being the sort of the universal framework, right? It can impact intergenerational and maternal outcomes, but also neighborhoods. But again, we do have evidence that there are some disparities in availability of programs at that neighborhood level. And then finally, I would say, I had the pleasure in 2019 to be part of the National Academies of Sciences, Engineering, Medicine Committee. And the report that we pushed out was called Vibrant and Healthy, Aligning Science, Practice, and Policy to Advance Health Equity. And we actually recognize the importance and value of Headstart for health equity, and health equity is broadly speaking. And I remember one of our key recommendations was that, and that for those who are following, it was recommendation 7-3. And specifically we said, federal, state, local, tribal, and territorial policymakers should work with the Department of Health and Human Services, the Office of Headstart, and the Office of Child Care to develop and implement a plan to, one, improve the quality of early care education programs by adopting the health promoting standards discussed in a previous recommendation, by building on the performance standards of early Headstart and Headstart. And within 10 years, expand access to such comprehensive, high quality and affordable early care education programs across multiple settings. So we saw Headstart as the one way to ensure health equity because of their performance standards, as you just articulated. And to me, going back to 2019 and that particular recommendation in this conversation with you, is that this recommendation from the National Academies is even more present, as you have articulated, as we continue to deal with the pandemic, with the growing childcare crisis. It is a crisis that Black and Latinx children in particular, and children from low-income households, are going to and still are going to experience the worst and carry the burden if we don't act on create a more robust, comprehensive system. It is our responsibility and our duty not to shortchange them, because the science already tells us that to support children's development, it must be holistic, it must be comprehensive, it must be culturally grounded, and it must be equitable. And based on the report that Children's Equity Project, Chantel and team have pulled together, we know that this is possible. And we are in that cusp of where this could be by using Headstart as sort of the underlying framework.
Thank you, Dr. Aruka. Dr. Gilliam, let's go to you. You are one of Dr. Ed Ziegler's students and now direct the center at Yale that is named after him. Give us your perspective on this. How can we build a universal system using what we know and the best science to deliver on equity, on access, and on quality?
Thank you very much, Dr. Meek. And I, let me start off by saying I agree with every single thing that Dr. Aruka so eloquently just stated, all true. And thank you so much for pointing out my connection to Head Start through my mentor, Dr. Ed Ziegler. I was very fortunate to have been able to work and to learn at the knee of Dr. Ziegler, who many people refer to as the father of Head Start. But the reality is that Head Start, of course, has many fathers and many mothers, because success always has no problem finding mothers and fathers, and Head Start is an incredibly successful program. But the stories that I heard about Head Start could have only really come from Dr. Ziegler. He was the last, when he passed away about 2 years ago, he was the last living member of the Head Start Planning Committee that put Head Start together during the summer of 1965. And he was there when the Comprehensive Child Development Act that Dr. Aruka was referencing earlier almost was signed into law. It passed the House very comfortably. It overwhelmingly passed the Senate. And it would have created a system of universal preschool education, universal childcare for any and every family who wanted it in the United States. And it was built off of a model of Head Start. Clearly, when you read that piece of legislation, it was about taking what children need in terms of care and combining it with comprehensive services that Dr. Aruka was talking about in terms of health services, mental health services, and parental involvement and community involvement, and creating from that a system of care that would not only take care of children so that their parents could go to work, but also take care of children well, take care of children's health needs, educational needs, mental health needs, family support needs, all of those things together. And it was predicated on basically the idea that Head Start is something that should be available to all children and families. The one thing that Dr. Ziegler had always said was that his one big regret with Head Start was that it wasn't a universal program, that it wasn't available to everybody, that it wasn't something that every family could avail themselves of. And when you think about a time when we need a system of care that doesn't just take care of children's educational needs, but also realizes that children are embedded within families, embedded within communities, a system that also realizes that care and health and mental health are all intertwined. I can't think of a time when that is more needed than right now, coming out of this pandemic, or in the middle of this pandemic, or wherever we are right now in this pandemic. Right now, that is what children and families need. And so when I think about Head Start, what I think about is I think about it as a promise of what could be for all of our children and families, deeply embedded in equity. But it will never fully be able to get there until we can think about ways in which all children and families can participate in this. And so when I think about Head Start, I think about it in those terms. I think about it in terms of the fact that Head Start was very early on in understanding the importance and the centrality of families, that children cannot be pulled out of families and into other systems. They need to be served within the context of their families, within the context of their communities. And I also think about Head Start as a safety net. As you referenced before, I've been doing research for quite a while now on children being kicked out and expelled from early educational programs. And I can tell you this, oftentimes when they get kicked out of, expelled from childcare programs, pre-K programs, the place that they end up oftentimes is in Head Start, because Head Start won't, because Head Start will take care of them. And so trying to find ways where we can build a collaborative system between Head Start and childcare and our pre-K systems in the public schools would be the very best gift that we could possibly give to our children.
Thank you, Dr. Gilliam. Dr. Aruka, I'm gonna go back to you for another question here. How can Head Start be part of connecting such a splintered system and evening out the playing field, so to speak?
Great question. As I would say, first we as you said earlier, right? Again, Head Start is not perfect, right? I mean, we believe it could sort of be sort of that sort of comprehensive program that really gets us started. Like it's almost like, like we think about children's development, we need to build that foundation. But what we also have to recognize that there are other aspects of sort of the early learning system of programming, including our childcare and obviously our pre-K programs. And so the question is, how do we take the best of what is childcare and what it gives to families, including our home-based providers, our friend and family neighbor, care, and also our pre-K programs that every state, a majority of states are enacted. So how do we also make sure that we bring that together? And so again, in your paper, right, there's a reference to building out more of the Headstart childcare partnerships. There's also sort of building out the Headstart pre-K partnerships. And again, we want to continue to sort of, push Headstart performance standards to really attend to equity fully into the equitable access, equitable experiences and outcomes. And we can't do that without making sure that we don't lose all the providers who are in different systems. It could really be sort of that connector and that braider, right? By having a federal system, it allows all the local, actors and all the sort of state partners to really come together. Again, as both you and Dr. Gilman have highlighted, that there are really strong components of Headstart that can really make it easier for families and communities to really develop a strong, comprehensive system that's robust enough to be able to say, you know what, if we have challenges in particular aspects of our system, Headstart could be that foundation to ensure that we really leverage and leverage our community childcare program and our pre-K program. And again, we have to continue to not fracture a system. We're not arguing to fracture a system that's still trying to create universality. And so I think one way is really to make sure that Headstart in many ways is that foundation, but continues to figure out how do we innovate and continue to connect the dots with childcare and all the different sort of early care education programming. Because at the end of it, we want to continue to push for equity and equitable access outcomes and experiences.
Thank you, Dr. Aruka. Dr. Gillian, I'm gonna kick it back to you. In the paper, we kind of outline one way that we can kind of bring pre-K at the state and local level together with federal funding. And part of it is largely modeled around some work that DC did in a blended funding model, where we kind of blend funds and then apply to standards, apply common standards, Headstart standards across the entirety of the system, regardless of who you're funded by, right? Can you take us down to the ground level and speak a little bit more to what pre-K and Headstart partnerships could look like?
Well, thank you for that question. About, I think it was 13 years ago, my colleagues and I at Yale were conducting a study, and it was a study of close to 4,000 childcare programs, were actually state-funded pre-K programs. So these were all pre-K programs that were mostly administered through state departments of education all across the country to look at what do these programs look like and how do they match the policies that might be in place in those states. And of course, when you survey state-funded pre-K programs, you're going to find a lot of Headstart, because a lot of state-funded pre-K programs are indeed a Headstart grantee. About 20% of state-funded pre-K programs are a Headstart grantee. The overlap is already there. And so what that gave us was an interesting opportunity to see, well, what does a child and a family get if they enroll in a state-funded pre-K program? What do they get if they enroll in a Headstart program? What do they get if they enroll in a Headstart program where the school is the grantee, where there actually is collaboration built into it? And what we ultimately found was that when children enroll in schools, they get access to a lot of educational opportunities. They get access to typically a teacher who's better paid, who might be part of a bargaining unit, a teacher who might have more resources, closer access to special education, a lot of educational stuff. But what they don't get are the things that Headstart really specializes in. They don't get health care. They don't get access to health supports, mental health supports. They don't get access to parental involvement and engagement opportunities and community kind of things. What we also found was that in the pre-K programs in the public schools, the group sizes and the teacher-child ratios were typically much larger than what you get in Headstart. But when children were enrolled in a program where the Headstart grantee was in the public schools, what they got was the best of both worlds and the challenges of neither. And what was interesting at that time for us is that it was completely clear to us that if we really wanted to be providing the very best opportunities for our children and families, we'd make sure that we adults are playing well in the sandbox before we try to expect that the children are going to play well in the sandbox. That we right now have a system that's tripartite, where if you need the childcare hours, you go to childcare. If you're interested in education and getting your child into a public school that might be where the siblings are, then that's where you would go. But if you need the comprehensive services, then you would go in the family involvement, you would go to Headstart. But the reality is children need all of those things. And we shouldn't be breaking apart our systems in a way that breaks apart our children. And so what we learned even back then from that is that it can be done. There are models indeed where it is done, but it can't be done in an environment where you have advocates for one system or another system that are not really focusing on what's best for all children. And what's best for all children is for all of us adults to get our act together and find a way to be able to collaborate better across these systems, to be able to put together better packages of whole child, whole family, whole community services. And that's the best way that we can serve our children.
So I'm going to round us off by asking both Dr. Ruka and Dr. Gilliam to share just kind of the one takeaway you want folks to walk away from when we're thinking about this Head Start and the universal pre-K system and what's best for kids. So Dr. Ruka, I'll start with you.
Thank you. I would just say, I mean, there's a lot. Well, first is read the report. There's a lot of, I think, really transferable information there. And the other thing I would say is that part of Headstart is also innovation, and that it allows the space for innovation. And to me, that is really important. If we're trying to sort of transform the lives of children, families, and communities, that is important that we have a comprehensive federal program that can truly allow for innovation. So for example, there's a network called the Ideal Learning Headstart Network that's trying to bring programs that likely serve mostly, higher income white middle-class families, and then bring that together with Headstart, right? Montessori programs with Headstart or Reggio with Headstart. Again, being able to provide innovation, but also provide equitable opportunities where we are fully, actually, authentically integrating our children, our families, but also some of these rich resources that often don't come together. So for me, read the report, but also think about the opportunities to innovate when we have a comprehensive, holistic system that meets the needs of children and their families and communities.
Dr. Gilliam?
I'm not sure I can build on that. I totally agree. Head Start was always began as an experiment that was going to learn from itself and make itself better over the years. And it indeed has done that. I think my biggest takeaway from this that I would hope that others will take is that this can be done. We can collaborate in better ways to be able to build better systems for children and families, especially when we realize that we all have different building blocks. And that if we really want to build something that's stable and helpful to children and families, we will be putting our resources together for children and families, and that we will be building it from the family and from the community up, not in terms of trying to fit children into institutional settings, but rather than realizing that the institution needs to be wrapped around the children and the families, because that's where you have to start. And really, truly, that's where Head Start's bread and butter has always been, in terms of understanding that children are embedded in families and communities, and it's from the family and the community level that you have to build anything that's going to be truly beneficial to children and families.
Thank you both. So with limited legislative text, as we know that implementation is going to really matter. And for that, the administration obviously has a central role to play in what all of this is ultimately going to look like. So I'm so excited to turn it over to a representative from the Biden administration, Katie Hamm. Katie is the Deputy Assistant Secretary for the Office of Early Childhood Development. Before joining the Biden administration, she was the Vice President for Early Childhood Policy at the Center for American Progress. And previously, she was a career civil servant in the U.S. Office of Management and Budget and a Presidential Management Fellow. Welcome, Katie. We're excited to hear from you.
Thank you so much. Can you give me a thumbs up if you can hear me okay?
Okay.
Okay, great. My headphones have been in and out today, so I wanted to make sure. It's great to be talking with you all today. It's a big day for early childhood. As some of you know, right now, as I speak, the House Ed and Labor committee is marking up a bill that would invest $450 billion in early childhood programs. So I'll talk a little bit more about that today and what it might mean for Head Start. I will say I caught just the end of Dr. Gilliam's presentation, and it really resonated with me as a parent because my son was in preschool here in DC, but he was dually enrolled in Head Start because of a local option that allowed for that. And I really did feel like we got the best of both worlds with the family engagement, the focus on socio-emotional learning, the small class sizes. And it was just an amazing experience. And I'm hoping that some of the investments that we are hopefully going to be making in the next few months will really allow that to be more of a typical experience for young children in this country. So I'm going to talk a little bit about where we are right now in our process and what to kind of expect and how Head Start fits into the administration's vision for early childhood. So the president put forward the Build Back Better agenda, which included investments in universal preschool for all 3 and 4-year-olds, as well as a major investment in childcare to make sure that families have access to childcare assistance if they are low income or if they are in middle-class families that struggle to afford childcare, capping what a family pays at 7% of their income. There's also the goal of addressing wages across the early childhood sector so that people aren't paid different wages because of the setting that they work in, and that we say wages go up across the board. There's also a commitment to quality and making sure that all children have access to high quality programs, regardless of whether they're in a home-based setting, a Head Start program, a school setting, a childcare center. Want to make sure that that is true across the board. So as I said, right now, the House is marking up their bill. It'll then go to the Senate, where it will ideally pass through a process called reconciliation, which means that everything has to be really closely related to a budget provision. So there'll be some back and forth about what is allowable through that process and what is not. So it's probably going to be a very windy road, but we're really excited to see some elements of what the president proposed moving forward. I do want to mention before I go into some of the other details that one of the things that the president proposed was a direct investment in Head Start wages and professional development. And we were really grateful to see that that was included in the House's draft bill, and really committed to making sure that we're investing in the Head Start workforce, which we know is really just central to everything we do in the program. So as we kind of embark on our pursuit of investments in childcare and preschool, Head Start, as you all know, is already an important provider of pre-K services across the country. And as I said, the new Universal Preschool program will be offered in a mixed delivery system, which means that pre-K services will be delivered through Head Start programs, as well as school-based and licensed childcare centers and family childcare homes. Head Start's program standards are a model for quality preschool. We've known for years that Head Start provides the gold standard when it comes to quality. And I was, like I said, very grateful to have the opportunity to experience that firsthand. Any universal preschool program really needs to work for families. And one of Head Start's strengths is empowering families as they navigate a sometimes complicated system and advocating for their children in educational settings. So Head Start will continue to be a federal and local program with national standards that serve our nation's highest need children and families. And Head Start programs will also be eligible to provide pre-K services through a state's mixed delivery system that gives families maximum choice in selecting the program that is right for their child and their family. The Universal Preschool program is designed to be scaled up over time and does strive to eventually serve all 3 and 4-year-olds through a variety of settings, but starting with the highest need communities first. While Head Start also serves infants and toddlers, states will not be expected to serve children younger than 3 in the state UPK system. Those states that have less established pre-K systems will need to do some work to kind of build out. And we expect that Head Start could be a partner in those cases because, in every state across the country, we know that Head Start grantees are already there and already serving children, even if this is a new program for the state. We are, as I said, really invested in high quality educational opportunities for 3 and 4-year-olds that focus on school readiness, but Head Start grantees will continue to provide the high quality 2-generational comprehensive services that support family well-being, help lift families out of poverty. Head Start's comprehensive services will continue to support children's health, mental health, social, emotional well-being, transitions, family support to address economic well-being, health, nutrition, and mental health needs of the families. One of the really key cornerstones is that the AFP calls for increased wages for preschool teachers, including Head Start teachers. We're still working the details out in Congress, but the plan will recognize that low pay is a significant challenge for early educators. We're grateful that that's being recognized in Congress. What the president proposed is that there's a $15 minimum wage, and that becomes a floor, and that we create wage parity for teachers that have the same qualifications as elementary school teachers. And I think this is really important for Head Start, where there has been a requirement to increase the proportion of teachers with a bachelor's degree nationwide without the wage parity. So this would put wage parity really front and center. So in closing, I'll just say that we really feel that the American Families Plan is a once-in-a-generation investment in children, in families, in our economic future. We see Head Start as really critical as a leader that has really shown us the way, that has helped build the evidence base, that has shown what the importance of centering equity, of focusing on dual language learners, focusing on children experiencing homelessness, children with disabilities. And we want to make sure that we take those lessons learned and carry them forward as we think about universal preschool and how it can build on the success of Head Start. We also know that a lot of families would benefit from more affordable childcare, and that in a lot of programs, we see childcare augmenting the Head Start day. So we think that that will be a really important component for low-income working families. And there are a number of other components of the Build Back Better plan that we really think will support families with young children that are struggling economically. And that includes nutritional supports, and includes financial supports, in addition to the early childhood expansion. So with that, I will just thank you all for having me. I'm happy to turn things back over to Chantel, or take any questions in any time remaining. But I know you have a busy schedule, so let me know how you want to proceed.
Thank you,
Okay.
Katie. I think we're going to pitch it over to Yasmina and Kent now for the next part of the discussion.
Great. Yes. Thank you so much, Katie. And I'd be remiss also if I didn't also thank and recognize the administration's efforts and commitment, as well as those in Congress, to expanding the child tax credit, which is going to do so much to reduce child poverty in our country. So looking at the holistic range of policies and programs the administration supports, and the focus on equity is really inspiring to the Head Start community, and really great to hear from you today, how much your vision, I think the administration's vision, has in common with what we heard from the research panel about the commitment to the family-centered model of Head Start and early Head Start, and also investing in the workforce as well. Without the caring and professionals, right, in early childhood, we don't have early childhood programs at all. So I think it's a long overdue recognition of their contribution to child development, brain development, and family strengthening as well. I think another clear commonality there, right, is being the adults in the room, getting the adults to collaborate, right, and getting children the services they need, no matter what neighborhood, community, funding stream, program, teacher they have. Head Start is excited to be that trusted partner and that model at this time, this real time of inflection and change, and really, again, honored to have you here today. So if everyone could please join me in thanking Katie in the chat. Katie, thank you so much for your remarks today. So for those who don't know, my name is Kent Mitchell, and I'm the Director of State Affairs for the National Head Start Association. And we're going to pivot now to our roundtable. So I'm really honored to introduce and facilitate our roundtable of representatives from leading early childhood advocacy and equity-focused organizations. Collectively, they work to raise the voices and perspectives of Black and Hispanic families, community action agencies, moms, and state leaders working to build inclusive systems of early care and education. They each represent critical stakeholders who will be impacted by what Congress does around early childhood care and education, and they are also experts in their own right. So we'll drop their bios in the chat, but I wanted to introduce them a little bit today. Amalia Chamorro is the Director of Education Policy Project with Unidos US. Christopher Roundtree is the Policy Analyst with the National Black Child Development Institute. Janina Perez is the National Campaign Director for Moms Rising Together and Moms Rising Education Fund. And she's joined by Sheila Arias, a North Carolina Campaign Associate with Moms Rising. Ryan Gilman is the Project Director for Public Policy and Advocacy with the National Community Action Partnership. Sherry Killen Stewart is the Director of Systems Alignment and Integration and Co-Director of State Services with the Build Initiative. And Stephanie Schmidt is the Director of Child Care and Early Education with the Center for Law and Social Policy. So for our folks on the roundtable, go ahead and raise your hand if you want to get your word in, or go ahead and take yourself off mute. But our first question is really about what you heard today from the research panel or from Katie Hamm. What do you want to build on from what you heard? What do you want to lift up? What resonated with you?
I think the one thing that resonated for me, and thank you, Kent, for this opportunity, because I come representing the voice of state leaders. I was a previous commissioner, but also leaders, especially Black leaders of small programs that sometimes feel excluded from opportunity because of the resources they may not have. But the thing that Dr. Meek started with that still sticks with me is the importance of having community that looked like her. She talked about that in her own personal introduction. And I think ensuring that as we think about Head Start as a foundation, that we're building bridges, and we're also tailoring and making sure these programs can really show up in communities. Other thoughts around standards, no disagreement that we should have standards, but from the state perspective, many states have 8, 9 different programs, and listening to families, which I do a lot, it is very confusing. And so we need to be cautious about how we add to QRS and licensing, any sort of broad Head Start standards, difficult at the program level, but also difficult for families to be able to interpret. So we need to think about how we're simplifying those messages and really intentionally tailoring the opportunity in communities, that we're not creating more competition amongst public school, amongst childcare, amongst Head Start, but we're thinking about a community and its asset and understanding the root causes of the disinvestment. One of the reasons Head Start works is that it ensures access to healthcare and dental and thinks about food, but it often happens in a context where that's not in the larger community. And I think both those things need to work together if we're calling this equity in terms of increasing access, removing barriers to those opportunities, and really distributing resources in a different way, which means patient capital. And sometimes the 10% requirement for the match in Head Start may exclude some communities and some small organizations from participating.
Great. So I mean, really deep remarks. Thank you so much, Sherry. And we know that this is kind of phase 1 of this process. And so working collaboratively, working together to remove barriers is going to be critical, and being inclusive about the settings, the programs, the families, and drawing on their assets. So appreciate that. Christopher, you have your hand raised.
Good afternoon, everyone. First of all, I just wanted to say I am just honored to be a part of this just presentation, just thought piece. So thank you for that. What really resonated with me is both Dr. Gilman and Dr. Aruka, just their wealth and dearth of knowledge and research and how important their research is, but just the foundational strategies for Head Start are just, it's such a prerequisite for children universally, just all around. Like it is known that we need this in all communities, and just how the federal government has just kind of left, children who are, 0 to 3, from 3 to 5, they're on their own. Parents are on their own, and the research really supports that is something that could help benefit, just the future of our nation, the future of our children. It goes hand in hand. And one of the biggest things, the reason why this resonates so much with myself and the National Black Child Development Institute is it's just a little history just about the Head Start program and how NBCDI is kind of integrated within Head Start. So in the 1960s, our founder, Evelyn K. Moore, she was an early educator for the Preschool Project, which was a program that provided high quality childhood education to 3- and 4-year-olds in African-American communities who were living in poverty and who were kind of assessed to be high risk of school failure. But this groundbreaking program for the preschool, for the Preschool, which later got adopted by high school, became one of the early models for the federal Head Start program, which we are, just something that we really champion behind. And the project began as a research study seeking to answer whether, high quality education could have a positive impact on the Black community, on those who were considered high risk, and how the development within preschool would later, extend their development for all areas of learning, and then, within their adulthood. And it was established for lasting human and financial value in early childhood education. So this is one of the longest longitudinal studies just in the nation. And I believe it's either one of the first, but I know it's one of the longest, if not the longest. And what the study really found, that at the age of 40, and this was beginning in the 60s. So at the age of 40, those who went through the Preschool project experienced a lot of different things within the program. But what the numbers really showed is that they had fewer teenage pregnancies. They were more likely to have graduated from high school. They were more likely to have a job, hold a job, and have a high earning job. They committed fewer crimes. They were incarcerated less. They were locked up less. And one of the biggest aspects of it is that they had the financial savvy to not only own cars, but also to seek the foundational strategy of owning their own home. So NBCDI, just as a program, we value Head Start as a foundational model for many different things. For universal pre-K, this would be the base method model that everyone should use. And this will really help our youngest earners, our youngest learners, as well as our much needed caregivers.
Thank you, Christopher. And thank you for bringing in the long-term effects. What Head Start does today, what our early childhood system does in the coming years, 40 years from now, will still be paying dividends. And that's what's the incredible thing. And you also got a shout out from Dr. Gilliam for bringing Evelyn Moore into the conversation here. So thank you, Dr. Gilliam. Janina.
Hello, everyone. First of all, I just want to say thank you for including Moms Rising as part of this conversation. We are, for those who don't know us, we're a national organization working with parents across the country on a broad range of issues, including early childhood. And Head Start is really, really popular among our families. It was one of our bread and butter issues that we first started working on, because we had so many families reaching out to us talking about how much they loved their Head Start programs and the way that Head Start programs worked with them as a whole family. And as we think about this, one of the things that has been coming up again and again, and I heard mention of it in the presentations, and I really wanted to think about this deeply and ask the question. I really appreciate the conversation around pre-K. I assume to have a preschooler myself, and a bilingual one who would really benefit from a Head Start dual language program. And if we had, if we could have access to it. And one of the things though that we've been hearing, particularly in the last 8 years, is how much people are struggling to find care in the 0 to 3 range. And so we've been really focused on early Head Start and early programs and childcare programs, and how is it that we can expand eligibility and expand programs for those first 3 years, particularly because we know that so much brain development and growth happens in those periods. And also where parents are facing some of the hardest stressors really early on in parenting. which we know that when caregivers and the grown-ups around children are stressed, it also impacts their growth and their development. So I would just love us all to challenge to think about, even as we think about preschool, that we not forget those youngest children, because what we hear disproportionately over and over again is that preschool is difficult to figure out sometimes, but not as hard to figure out for families as those first 3 years. I'm going to take a point of privilege and just switch it over to my hermana en la lucha, Shayla Arias, who actually does this work a lot more locally than I do, and has direct experience as well.
Thank you so much for the opportunity. I just wanted to, like Nina said, this is a great space and I feel really privileged to be here as a parent and also as a person who advocates and works with this. I am a true example of how early Head Start have really changed my life and matter of my kids' life. My child has benefited, my oldest, from early Head Start, and so is my other one. My oldest has special needs and continue to has, but because of early Head Start made her difference in everything. So also the programs that are put to place for parents who benefit early from early Head Start is not only changed their life at the time, but it's something that changed their outcomes for their future, for their kids. Because I was assisted with all these benefits and of these programs, I can now work with an organization like Moms Rising because the tools that they put in place and I follow them really, really work. So I'm not just here to say, let's just, continue to just do education. It's so much about what early Head Start brings to family, that connection, meeting families where they are, sometimes having that one-on-one time with your person that comes visit you makes a difference, but it also makes you feel good and assured in the long term. We are in the IP system in public schools now, but she's thriving because she was able to receive that early instructions that a lot of kids don't have. And because she has it, and because she's bilingual and already has that language barrier as a delay, all these things, places that teachers did for her with therapies, working with her therapies, working a different set, it really, really made a difference. So I am very excited for outcomes to come for our teachers who work so much in these settings, and it really help parents as well. At the end of the day, they also have their families. So going home to their families and dealing with this is also something that they live by. So I'm just, really hope that we can really think about early learning for all kids because it makes a difference for all kids.
Sheila, thank you for sharing your story today, and congratulations on how well your family is doing. Early Head Start is a critical part of the Head Start continuum. Unfortunately, funding is so narrow, it only serves 1 out of 11 eligible children. I think there's some really great opportunities if there's truly going to be universal access or much more affordable access to childcare, to make sure that that childcare offers the kinds of wraparound and supportive comprehensive services and family engagement that the early Head Start model provides. So I think there's opportunities to work on both in Congress and then also to see through if Congress passes this legislation. And you keyed in on a couple of really important things, and I encourage others to build on early Head Start and infant toddler care here too, but the need for bilingual and culturally competent services. America is constantly changing. That's one of the strengths of America. We're always changing and shifting, and we need to respond to the needs of young children, including linguistic and their cultural strengths, but also that early identification of disabilities. Nothing could be more important, right, than catching those early and working toward kindergarten readiness and child development. So apologies for the long segue there, but I'm also an advocate and passionate about early Head Start. So Ryan, I know you've had your hand up for some time, and I'll go to you.
Sure, thanks, Kent. No apology necessary, for sure. Hi, everyone. My name is Ryan Gilman. I work for the National Community Action Partnership. I just want to say thanks again. I know others have said, but just thanks to NHSA and Children's Equity Project for organizing this briefing. I just think these issues are so important. For folks that aren't familiar with the work that we do, we support over 1,000 community action agencies across the country. About half of our agencies run a Head Start program, they're Head Start grantees, and about a third of all Head Start enrollees are enrolled in a Head Start program that is run out of a community action agency. Over the past couple of years, we've put together a couple of groups that are internal to the network. One is a Head Start task force, and one is an Equity and Economic Mobility Commission. Both of those bodies include members from all over the country, from Hawaii to Maine, essentially, and in all different regions, urban, rural, frontier. So it has been really interesting to hear all of the feedback from across the country, especially from Head Start agencies. And I just want to hold up a couple of issues, or raise up a couple of issues rather. The first one is that, as others have said, we have heard over and over again about staff compensation, certification issues. So that's something that's certainly going on, and we were, we're pleased to see some sort of, positive provisions in some of the language that we've seen so far for this reconciliation bill. I will say the other issue is, we're constantly hearing about equity issues and how important it is to center equity, and that's part of our work as well. I just want to, in that vein, sort of raise up something that Hamm said, which is she mentioned empowering families. And I just think that really needs to be at the center of all of this work. I know some of the questions, certainly are going to be about implementation, because that's sort of where the rubber meets the road in a way. And where, as we've seen in the past, we know that's where people get left behind, whole communities get left behind. And I just think that from our perspective, for implementation, it's so important to empower families by giving them a seat at the table. I think this pandemic has shown us that the Head Start community is so capable of innovating and being flexible and creating new opportunities. And every community deserves that. And so I just think that in the implementation process, we really need to include as many parents and Head Start graduates as possible, just to make sure that all of the results, all of the outcomes are equitable across the board. And we're really looking forward to partnering with everyone on the work going forward. So thanks, Ken.
Great, thank you, Ryan. Stephanie.
Thanks, Kent, and thanks for hosting this event, NHSA and CEP. I'm very grateful to be here with all the folks on the panel today, and wanted to say +1 to nearly everything that folks have highlighted already, especially the pieces that Nina and Sheila highlighted related to the important role that early Head Start plays in meeting the needs of infants and toddlers and providing comprehensive supports for those families. I am here on behalf of CLASP, the Center for Law and Social Policy. CLASP is a nonprofit anti-poverty organization that works at the federal, state, and local level to really ensure there are policies in place that improve the lives of families with low incomes and centers equity. What struck me as all of the researchers and Katie were speaking was just how much potential and opportunity lies ahead of us to write the path for children and families with what we hope will pass in the reconciliation process. I keep thinking about the history of racism in childcare and early education and Head Start's creation in the civil rights movement to really address poverty and other circumstances that resulted from racism for families of color, but also the historic lack of funding in Head Start and early Head Start to be able to meet the need that exists, and how those two pieces have been misaligned for the history of the program, the investment in the program, and the need that exists in the sort of mission of Head Start and early Head Start. And I think, being an optimist, I can't help but think about how the inclusion of these hundreds of billions of dollars over a period of time in the reconciliation bill being marked up right now can really change the trajectory for millions of children and families in this country. And I'm particularly thinking about the provisions in the bill that really provide openings for Headstart standards and structures to be expanded, which Katie sort of walked us through already, and built upon so that more children, including children in harder to reach places like Dr. Aruka highlighted, have access to high quality care by providers who are well compensated and supportive, and just really want to sort of take in the moment where we are right now at the cusp of achieving the biggest investments in affordable, high quality childcare and early education in our nation's history, which I was so excited about already. And this research panel just really underscored for me what that will mean in terms of value it will bring to providers and children and families, and particularly for children and families with low incomes and children and families of color.
Great. If I could just kind of ask you another question and kind of build on what you said, and bringing back something Sherry said before, you know, if we're not careful, there are too many standards and there are programs that might get left out if, right, as Walter said, the adults in the room don't collaborate, simplify, center the family. CLASP does a lot of work and relationship building in the childcare sector, including with state administrators. I mean, are there parts of the early childhood sector you're concerned about? What would you tell our audience? You know, we need to be inclusive of who, what, you know, I would love to hear any more perspectives about that so we can, in Sherry's words, right, not leave out communities who need quality. And Sherry, you can chime in after Stephanie, please.
Sure, thanks for the follow-up question. I do think, to the point that a lot of folks have already highlighted on this call, the role that providers and parents can play in informing the process and being part of the process is really what this all comes back to. To me, I think there is obviously a big implementation agenda ahead. And I think in figuring out how we translate what Katie highlighted was included in what the Ed and Labor Committee is marking up right now to reality, and how we ensure that you know, programs who are best meeting the needs of families and children are included is by bringing this back to the ground and letting parents and providers share what is meaningful to them, who are the providers that are having the most impact on them, and how can they be included, and what is the path forward. So I think it's really about ensuring that as we pass the bill and move to the implementation phase, that's driven by parents and providers on the ground with the support and buy-in and connectedness of both the childcare and Head Start sectors, and letting the adults, to the point that folks were making and Dr. Gilliam was making, you know, not be the people who cause harm for the children who are really and families who are really going to benefit from the program.
Thank you, Stephanie. I would agree with Stephanie's answer, and I would add that we really have to, and we've got plenty of data to know where children are being served and where children are not being served. And we need to let the places and the listening that Stephanie described, both to families and providers, drive where we build the practice and where we build the service. And then we've got to be able to invest in bridges, because these places are disinvested in, as was mentioned by several speakers, over the long haul, not the short haul. And so it's going to take additional investment in order to build, so that we're not creating competition and exclusion in our practice, but really picking the place where children are and building. And there'll be some tension between small programs and large programs. Often we know programs have to be a certain size for the numbers to work. But if you're in a rural community or you're in an urban community that's been disinvested in, and you want the program to be in the footprint of the family so that families can participate, we've got to be able to invest in that place. So hopefully the implementation is going to have lots of bridges that allow us to tailor in the way that Stephanie's describing, both for the workforce, going back to Dr. Meeks's first comment, so that the workforce looks like the children and family, but also for the programs and the facilities to be able to meet the standards and not feel, because I worry in the federal comment that it'll continue to be federal to local. So that creates competition and scoring and exclusion, and you don't meet a standard and you're out. So there has to be a place similar to QIS, and I'm not fighting for one over the other, that is about continuous improvement in the way that we do the work, the way early Head Start began in trying to create partnerships in childcare.
Great. Thank you, Sherry. Thank you so much. Amalia.
Hi, everyone. I'm Amalia Chamorro with Unidas US. We're formerly the National Council of La Raza, so that's still a name that's familiar to many of you. But I mean, there's several things that resonated with me, so I would just echo, what my fellow advocates have chimed in on. But I did want to pick up on a thread that you, Kent, and Shayla also elevated, which is around dual language learners, right? And making sure that if we are to expand, and I hope we do, right, expand to universal pre-K, to make sure that dual language learning is part of the programming and the services that are embedded in the curriculum, because there has been a history, right, of discrimination over the last few decades, right, in terms of extinguishing and diminishing one's home language, when research actually shows that children can learn more than one language and can absorb more than one language from a very early age. And that extinguishing their home language actually, is not something that we should be encouraging, because it actually affects their sense of belonging and self-identity, right? Home language is part of the culture that is very much rooted in their self-identity and how they identify with their families and with their communities. And so it's very important that as we continue to expand and build on early childhood education, that dual language learning continues to be a part of that programming, and to also make sure that that's part of what makes for high quality early childhood education, right? And that's one piece that I wanted to pick up on, but also to say that having a diverse ECE workforce is part of meeting that challenge, right? To make sure that we actually have a workforce that is culturally and linguistically competent, right? To be able to provide those learning opportunities to our youngest learners. And 1 in 5 ECE workers, we've done research and did a series of focus groups over the last couple of years, but 1 in 5 ECE workers are Latinas, right? So we know that most of our ECE workers are women of color. And so that pay parity is ever so important. And we do know that many of our affiliates, right, who work with these ECE teachers, right, have done what they can to be able to compensate. But we also need, their grants, right, to be able to go up and be able to provide for that higher compensation, so that our workers can be recognized for the professionals that they are, right? They're going out there getting those BAs, right? Putting in those extra hours to get those certifications and degrees, and they're not seeing that reflected in their compensation. So I would say those two pieces in terms of making sure that we have dual language learning as part of the expansion to make sure that children are getting the high quality, and also supporting the diversification of our ECE workforce.
Thank you so much. I mean, making dual language learning normative sounds like an incredible goal for this moment in time, and incredibly important for kids and families. And I know the Children's Equity Project report put a focus on that. And again, appreciate that report for bringing that to light. And you're taking us really to our next topic, which is that workforce issue. Clearly, it will be one of the most important investments Congress makes if they're able to follow through. And probably one of the more complicated ones for programs and for systems to implement as well. So I'd open up to anybody on the panel about what do you want to see happen with this workforce moment, this opportunity to invest in the workforce. What are the strategies you'd like to see or outcomes you want to see? I'd love to get a few comments in on that.
Yeah, I'd like to see us build the floor, and I think Katie talked about that in her presentation, that first we have to rise the floor. There are a lot of people already doing the work, And then we have to work with multiple systems to continue to increase education and competencies. But it's too often we create a new bar for people to jump over and not recognize that people are already doing the work and need to be paid now.
Excellent point. Thank you. Christopher?
Good afternoon again. So this is another important thing just with MBCDI just as a whole, because we have a new initiative, and Amelia, we've worked with Bob over there at Unidos on a joint brief about this, but we're really seeking just a responsible transformation of the early education workforce when it comes to new components, new requirements. And the one good thing about the Headstart program is that Headstart, you have to have certain educational requirements to meet that. So we know an important thing is that we want to make sure that there's one diversity in the early education workforce, because I don't believe you can be high quality or a well-qualified program without the essential component of diversity. That needs to be, just kind of first and foremost. And we know that 40% of ECE workers are people of color, and that is generally dominated by women of color. So some of the things that we are really pushing with this new initiative, and we're going to launch this at our 54 conference, by the way, which is October 14th and 15th. I think I've sent you guys all emails about that. So if you can register or whatever you want to do, we would love to have you. We want to examine the impact the new education requirements will have on early childhood education, especially those of color. And we want to explore how best to implement requirements, whether it's a bachelor's degree or whether it is some type of certification. It could be a community college degree, whatever it is. We want to make sure that this is also serving these educators, but also strengthening and not displacing the workforce. Because what a lot of times that can happen is that we have these new requirements. It's not done both equitably, fairly, however you want to call it. And then all of a sudden, those who have been working diligently within this already qualified community are removed from there. And then all of a sudden, the diversity just looks completely different, because we have removed segments who have been doing the work on the ground. They have been doing the bootstrap hard work with our children, but they're not getting credit for it. So one of the big things, and I won't bore you with the recommendations, we will send it out to you guys so you can see it. But one of the things is that we want to create clear pay bands for our early education teachers. Many of them, and we did roundtable discussions, these are people who felt like a lot of the parents and a lot of the community were looking more at them more as kind of not just daycare, but babysitting services, right? They are providing our children at the earliest age with great knowledge. That's where 75% of the early learning comes from, is when you're in those critical stages. We want to make sure that they're deemed as educators and not babysitters. And that will be qualified through pay bands, as well as making sure that there is work credit for work that they've already done within their communities.
And I think your comment builds so nice. I saw Sherry nodding her head too, that we are not here to displace people who have a passion and commitment. And your term responsible transformation is getting a lot of love in the chat too. And I think that's a great way to think about this. We have time for one more comment before our last topic. Janina?
Thank you so much. I just wanted to uplift a piece that Christopher said, and that I just think is so important also to families, is having educators that are representative of the communities that they're serving, doing that work, and how children need to see themselves in the folks that are doing their care, and also families. We also know one of the things that we hear often from providers that I think is, and from educators, that's really important, that I want us to just hold as we move forward in these conversations, is that so many times their own children cannot benefit from the amazing early childhood opportunities that they are providing in service themselves. And how is it that we make sure that those doing amazing work of building our children and building their minds also have access to these amazing programs for their own children, as we think about a universal system and what that looks like, and making sure that their children are close by so they can provide the best care as well.
Great, thank you so much. We have about 5 minutes left, and I'm going to ask my colleagues to put in the chat for everyone a place to sign up to take action with NHSA. But I do want to go to everyone on the panel. You each have about a minute, so relatively quick. What do you most want staff who are in Congress, who may be on the call today, or members in Congress to know about this moment in time what's the one priority or urgency or thing you want them to take away today? And I'll just go down the line. So Amalia, you're first, if you're prepared for that.
All right, sure. No, thanks for that question. Well, I hope, House Ed and Labor's members and staff's ears are ringing, right? Because we have been talking about this critical topic for the last hour and a half. And so I hope as they go through markup in real time, they're hearing all that we're sending to them, right? And hidden messages. But I would say, the one thing that I would like them to remember and take away from this moment is that this is a historic opportunity, right? And we can't afford to let another 50 years go by before we seize on another opportunity like this. This is once in a lifetime. And we have high expectations, right, of what we're looking to them to deliver, because this is the moment, right? We have gone through a pandemic. We have, parents and children who have been challenged as never before in terms of childcare and early learning opportunities. And this is the moment. So let's not waste it.
Amen to that. All right, Sherry.
Yeah, thank you, Kent, appreciate that. I just want them to remember build bridges and not blocks, that this is an opportunity for us to really build bridges across Head Start, childcare, public school, family, friend, and neighbor care was mentioned also in the chat, and that we're gonna have to have tailored responses to community. And that's gonna mean differentiated investment, that communities that have the most kids and most marginalized are not gonna have within their footprint access to libraries and museums and healthcare and dental care. And all of those are critical partners for Head Start to be successful. And those programs that exist in those communities, and they do exist, are often smaller and will need more support to meet whatever the standards, if you go federal to Head Start, or if you were to include some of the Head Start standards in the broader piece. And the most important piece is to listen to the people you say you want to benefit, listen to families, listen to the workforce, and build these community solutions that matter for the children and families. It doesn't work to have a 4-hour program or a 9 to 2 program if you've got a job that's in the evening or at some other time. And so we really need tailored community solutions in the footprint. We need to listen and, more important, be responsive to what those families are telling us.
Thank you so much. Janina.
I was in the middle of typing a yes, programs actually to match the reality of family. So I won't do that now, but I was curious about it. I think the thing I would say is that it's time, the families and early educators in our communities have really been bearing the brunt of inadequate funding for far too long. And that we have fantastic models like the early Head Start model, the Head Start model to lean on, and that there's no reason not to move forward on this. And particularly after what we've seen with the pandemic, we are asking so much of babies, of children, of families, and those amazing early educators without properly compensating them for the amazing work that they do. So it's just time. It's time to get it done. That's what I would say to them.
Thank you so much. Stephanie.
I would just add to everything that everyone else said that we are incredibly grateful for all of the tireless work that the folks on the Hill are doing, being close to the work of the committees, and that we appreciate their efforts to get this right, but to not let perfect be the enemy of the good, and to support what Ed and Labor has put forth, and know that we are here to support them and making this a reality.
Thank you so much. Ryan.
Thanks, Kent. I just want to echo Stephanie's gratitude, because I know everyone's been working really hard on this. So certainly thank you to the members and staff that are working tirelessly on this. I will just say just what others have said, that this is a huge opportunity that we can't let it pass us by, and that centering families in the work as it moves forward is crucial. And I just want to mention or sort of highlight a couple of things that Dr. Meek said that stuck with me. One is that I think it's important for all, for all of this to be on a sort of continuum. So just making sure that there's resources going forward for post Head Start, like continuing all of these wraparound services as folks need them, is so important to communities. So keeping that going, or just keeping that in folks' minds as we move forward. And then also, I loved what she said about picking a child that you know and thinking about a family that you know, and just picturing them as you're going through this work of not just, you know, the statutes, but also implementation, just having an eye towards that. And I think that's really important. So that's what I'll leave everyone with. Thanks, Ken.
Thank you so much. Sheila. Sheila, you're muted if you're still on the call.
I think she's still on, but she might be picking up.
Okay, let's go right to Christopher.
Well, I echo the sentiments of it's just been an incredible just array of thoughts, collections, opinions, facts, necessary ideas. It's just been incredible. We live in a society today with a very political climate that would say helping a segment of society is dubbed as an unnecessary entitlement. But providing $450 billion for foundational strategies that improve the lives of our earliest learners, our children, this helps American families. This is not an entitlement. It just simply isn't. It is a long overdue necessity that will improve the future of our children, which will actually improve the future outlook of our nation, which in turn increases chances that the next generation will be more encouraged to actually give birth to children, because we're saying we're having low birth rates. Why? Because it's expensive. But if we can help our young parents with necessities of life, which is education for our children, this will go a long way in improving just our outcomes for our federal government. And with a little federal and state intervention, we can go a long way to do positive things.
Amazing. Christopher, thank you so much. With that, I do want to go ahead and wrap up our roundtable today. First, please thank our roundtable folks in the chat. They did an amazing job representing a broad range of views, and we're grateful for their partnership at NHSA and with the Children's Equity Project. Just to recap quickly, I think there's some really core things we heard. This is an urgent and critical moment, and Congress has to follow through. So let's keep up the pressure together on them there. We have to work together as adults who are responsible for kids and families and well-being in our country. Many of us have a platform to do that day in and day out, and let's work together, not just now, but during implementation. We have to center the voices of families and communities, recognizing, as our research panel and our roundtable said, you know, children don't exist in a vacuum. They exist in a context, an environment, and a family, and we need to recognize that. And then finally, our workforce. Boy, is it long overdue, right? To invest in our workforce and to also speak to and address the needs of the diversity of our workforce and the need for that as we move forward. This is just the first of many conversations. NHSA, and I know all the others who spoke today, are implementation partners as this moves forward, if this moves forward. And for those turning into ed and labor, and enjoy that markup. It's probably going to go on for a couple days, but thank you for being here today. Look for more from NHSA and all the partners on the call. We're grateful for your commitment and your passion for young children, families, and communities. And I wish you the best the rest of your day and the rest of your week. Thank you so much.